Thanks a lot. Before starting, I really want to congratulate the organizers. As a matter of fact, I've been in discussion mainly with Julie, Agnieszka, and Kalina since the beginning of the organization of this meeting, and they are really outstanding to work with, and it's very nice to see the young generation so involved. So thanks a lot, and thanks a lot to Luisa and Ruben. Also, I've not been involved as much with you, but I'm sure you've been great contributors. So this afternoon session is on the risk factor and consequences of diabetes and obesity in different age groups. And we're going to start with the first presentation by Amélie Cléo KELLER. Amélie is a PhD student at the Institute of Preventive Medicine in Copenhagen. She holds a bachelor's degree in nutrition and dietetics from Geneva University, and a master's degree in public health from Sheffield University and Copenhagen University. Thanks a lot, Amélie.
Well, thanks a lot first for giving me the opportunity to have give this talk today. So, I'm from the Institute of Preventive Medicine in Copenhagen, but I'm originally actually from Switzerland, so if you have any question at the end in French, I can actually try to answer your question in French. So, today I'm going to talk about, first of all, the Institute where I'm working at in Copenhagen, and then focus my talk on one of our projects, the DETECT project, which is about prenatal vitamin D and onset of adult diseases, and mostly focus my talk on my PhD project, which is entitled Vitamin D, Prenatal Life and Risk of Later Development of Type 2 Diabetes. And this is not working. Okay, that's fine. So, the Institute of Preventive Medicine in Copenhagen was established in 1962, and originally it was an institute mostly looking at doing research on psychiatric disease, but from 1992 with the new director, Torkel Sørensen, there was a shift, and the aim of the institute from 1992 until nowadays is to conduct research and education regarding general mortality, obesity, diabetes, cardiovascular disease, cancer, and other epidemiological diseases, and as well to improve the knowledge that allows prevention of disease and promotion of health. And we are about 40 people working at the institute currently, mainly researchers, both from professor to PhD student and research assistant, and some administrative staff helping us. So here you have a list of some of our main ongoing projects. The DETECT project, which I'm going to talk about later on. And we also have other projects, such as the Healthy Start project, which targets obesity prevention among young children, and the Know-How project, which is, we just got a grant from the Horizon 2020 application, which is going to look at weight loss maintenance management. And other projects, that is the Gen Up, looking at gen diet interaction in obesity and child growth to cancer. If you have any interest in one of those other projects, you can look at our website. So, the DETECT project is a strategic research project connecting food, health, and lifestyle that is funded by the Program Commission on Health, Food and Welfare under the Danish Council for Strategic Research. And the project leader is Professor Berit Heitman, who got the idea of the project and also the main funding. So, the background behind this DETECT project is based on the Barker hypothesis, which you might be familiar with, also called the development origin of adult disease hypothesis. So, Barker and his colleague from Southampton University have done some epidemiological studies, both in animal and human, and have shown that what happened during the 9 months of pregnancy actually influenced the occurrence of adult diseases such as diabetes, obesity, and cardiovascular diseases. So, based on this idea, the background idea behind the DTEC project, which is looking at vitamin D, is that it's been shown that low vitamin D early in life may play a role in the development of abnormalities or diseases in different organs and tissues. And just a few words about vitamin D. So vitamin D can both come from the diet as well as the sun. And to be active, vitamin D needs to be hydroxylated twice. So a first time in the liver by the 25 hydroxylase. And this is actually the form that when we look at vitamin D in the serum, that's the form that we use because it's very stable. And then to be active, it has to be hydroxylated a second time in the kidney by the 125 hydroxylase. And this is the active form. Unfortunately, it cannot really be used in serum level because it's very unstable. And the known role of vitamin D is through phosphorus and calcium homeostasis and bone mineralization. However, in recent years, there's been many vitamin D receptors that have been found throughout the body, different cells and organs. For example, the pancreatic beta cells. So, in northern countries such as Denmark, as I said, the vitamin D comes both from the sun and the diet. Unfortunately, the sun is not shining as much as in Bordeaux there. So it's only during 6 months of the year, that we actually can synthesize vitamin D. During winter months, we rely mostly on food, also fortification of food or supplements. And the prevalence of vitamin D deficiency, which is defined as a level below 25 nanomoles per liter, is around 14% of the population of the Danish adults, and insufficiency is about half of the population. So the background for this idea, so the project is looking at vitamin D during prenatal life and the onset of disease during childhood and adulthood. And how come is it possible that we can actually do that? Is that in Denmark, there's a very well-defined period where margarine was fortified with vitamin D. And as you can see here, so the fortification of margarine with vitamin D, which was mandatory, began in January 1961 and was terminated in June 1985. And because we have this well-defined period, we can actually take birth cohorts of people that were born before and compare them with people born after the initiation of the fortification time and do the same around the termination of the fortification time. And so margarine was fortified with 1.25 micrograms of vitamin D per 100 grams of margarine, and this provided about 15% of the dietary vitamin D intake. As a comparison, it's interesting to know that in butter, usually it's about 2 to 10 micrograms per kilo of vitamin D that can be found in butter. So actually much higher level of vitamin D that was provided during this time period. And we can actually follow people, so people born around the initiation of the fortification for about 50 years, and people around the termination of the fortification are about 30 years now. And so how can we follow people for such a long period of time? As Bendix already introduced you, in Denmark there is a civil registration system. This is this yellow card. So everyone living in Denmark actually has this card and a unique identification number. And because of this number, we can follow the whole population. So basically, we can follow an individual since he or she is born until she or she dies or he dies. Of course, if this person stays in Denmark. And here is just a list of some registers. So you've been introduced to the Danish Diabetes Register that we're using in the DETECT project, and I'm also using in my PhD project. And one of the challenge, I could say, is to define type 1 and type 2 diabetes patient. It's possible, however, it's not perfect. We also have another register, which is called the Biological Specimen Bank for neonatal screening. We collect a dry blood spot from babies after they are born. I'm gonna talk about this in a few minutes. And here are other registers containing other types of data, such as data on whole hospitalization, data on obesity and birth weight, maternal obesity, birth complication, and as well as data on socioeconomic status, such as income or education, for example. So, to sum up, the DETECT is a societal intervention study that examines effects on health outcomes occurring up to 50 years later of low vitamin D during growth spurts, such as fetal life, adiposity rebound, and puberty, while also taking secular trends, season, and trimester into account. The advantage of such design is that there's no need for information on individual food intake, and people working with food study, dietary study, know that it's very difficult to actually collect data on that, so we don't need to. Confounders are equally distributed between the exposed and the non-exposed group, and the only difference is the exposure to the intervention, in that case the margarine fortification. Of course, there are some possible limitations to such design. One of it is the possibility of other societal and environmental changes that would have occurred simultaneously. However, we have not identified any. We work with some historians, and none could be identified. And there's also a chance for steady yearly change in disease, so circular trends. And but this can be adjusted for in statistical models. So currently we are looking at different outcomes. So one of them is diabetes, type 1 and type 2 diabetes. I'm going to talk more about type 2 diabetes later on. One of my colleagues is looking at obesity and birth weight, always in relation to prenatal with vitamin D. Another colleague is looking at fracture, preeclampsia, and schizophrenia. And we have currently some projects that are waiting funding to look also at asthma, other mental diseases, and as well as rheumatoid arthritis. So you've seen this figure earlier. So now I'm just talking a bit more about my own project, vitamin D and type 2 diabetes. So here you can see a figure from the International Diabetes Federation, which shows that in 2013 it was about 382 million people that were living with diabetes, and the prevalence is thought to increase by 55%, reaching almost 600 million by 2035. And so, as you know, also, it's been said this morning, type 2 diabetes is a metabolic disorder that is characterized by insulin resistance and a relative lack of insulin. And here is some data from European countries. So here we can see that apart from Finland, where the prevalence is quite stable, all the other countries see an increase in prevalence of diabetes. This is for type 2 diabetes. So in Denmark, from 1995 to 2010, we can see an increase from 170,000 to 241,000. And currently, the prevalence of type 2 diabetes in Denmark is about 4.5%. And however, there are many cases that are not diagnosed. About half of the people don't know that they have type 2 diabetes. So the true prevalence is going to be around 9%. And the incidence is between 10 to 20,000 new cases per year. So what is the link between vitamin D and type 2 diabetes? So vitamin D receptors have been found in pancreatic beta cells, and some studies have also shown that pancreatic beta cells are able to produce vitamin D. Vitamin D has also a role in insulin sensitivity by mediating calcium metabolism, which is important in the role of action of insulin, and may regulate insulin receptor gene expression that may modulate insulin resistance. A third path is for inflammation. Vitamin D ameliorates low-grade chronic inflammation. So the literature about prenatal vitamin D and the onset of adult disease is pretty scarce. And we have identified some studies looking at fetal vitamin D that show an association between low fetal vitamin D and birth weight and birth size, as well as impaired growth. And there's also some studies looking at actually animal model, mice, so this is not in humans, showing that low fetal vitamin D is associated with higher blood glucose 5 days after birth. Regarding more specifically fetal vitamin D and type 2 diabetes, there's no such study that have been identified. However, we identified one study from India that found that intrauterine exposure to low vitamin D during fetal life was associated with high insulin resistance at age 5 and 9.5 years old. So the objective of my PhD study is first to examine if low levels of vitamin D during gestation will have adverse effect on the long-term health of offspring, and as well as to examine if exposure to extra vitamin D fortified food beneficially affects the development of type 2 diabetes in adulthood. So, going back to the slide where you can see the initiation and termination of margarine fortification. For the first hypothesis, we're actually looking only at the initiation of this mandatory fortification of margarine, because type 2 diabetes usually develops later in life, so we can follow people for a longer period of time. And what we're going to do is to include people born between January 1959 and December 1960, and compare them with a cohort of people born around 1962 to March 1964. And the washout period, we have a washout period of 15 months, which we established because we want to have people to be truly exposed to this vitamin fortification. And we assessed that actually it took up to 6 months to establish margarine on the shelf, and then we add up 9 months of pregnancy. So we're sure that we actually comparing truly unexposed compared to truly exposed people. And what we expect to see is that people, or the hypothesis at least, is that people that were born after the initiation of the margarine fortification will have lower risk of developing type 2 diabetes later in life. The second hypothesis is around seasonal variation of vitamin D synthesis during pregnancy and onset of type 2 diabetes. So here we can see this is showing the serum level of vitamin D according to months of the year. This is actually data from England, but we expect that is pretty similar in Denmark. And we're gonna look at months of birth. So for example, someone born in July will be exposed to low vitamin D mainly during the second trimester. And as another example, if we take someone born in October, this person will have been exposed to low vitamin D mainly during the first trimester. So we want to look if exposure to low vitamin D either during the first, second, or third trimester differently impact the development of type 2 diabetes later in life. And the third hypothesis is regarding dry blood spots. So as I said earlier, we have this register, so these biobanks, where actually every newborn in Denmark gets a ill prick, or some blood is taken within 72 hours after birth to check for congenital diseases. I believe it's the same in other European countries. And this blood is actually stored in this biobank. And what we're going to do is to identify people that have developed type 2 diabetes using the register, and go back and find their dry blood spots that are stored in the biobank and analyze the level of vitamin D in those dry blood spots. So we can see the level of vitamin D they had at birth. And we're going to compare them with some match control, match for age and sex, and do the same, using the same principle. So we expect to see that people that develop type 2 diabetes later in life actually had lower serum level of vitamin D at birth. So unfortunately, I cannot show you any result because I just started. So you have to re-invite me in a couple of years. However, I can just tell you that some of my colleagues that are a bit more advanced in their project, not only someone looking at schizophrenia, this person has actually found that there was an association between fortification of margarine and the development of schizophrenia. So people that were exposed to vitamin D, margarine fortification with vitamin D, were at lower risk of developing schizophrenia later in life. However, this could not be found in obesity. We didn't find any statistical significant evidence with obesity. So with this, I would like to thank you for your attention. This is my research group, and yeah, the floor is open for questions, I guess.